Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And today's guests are Brian Davis, he's CIO at Magnolia Regional Health Center, and also Jim Hammer, he's SVP at Harmony Healthcare IT. Welcome guys.
Thank you for having us.
Yeah.
Thanks for the opportunity.
Yeah, so excited to learn about the topic today, but before we dive into the topic, how about you tell us a little bit about yourself and Harmony Healthcare IT?
Sure. Harmony Healthcare IT is a data management company. We do migration archival services for healthcare clients. I've been doing that since 2006.
Great. And how about yourself and also Magnolia Regional Health Center?
Yeah, so I'm the CIO there at Magnolia. I've been there for about 15 years, and Magnolia is a 200-bed acute care facility servicing 7 counties in northeast Mississippi and south central Tennessee.
Excellent. So you recently went through a migration to a new version of MEDITECH. Tell us about that decision to only migrate part of the records to the new system and kind of that whole process.
Sure. So, in 2015, we had a physician-led initiative to upgrade our EHR, and through that, we also decided to go to a single medical record. So we were coming off multiple legacy systems, and so I guess each one of those opportunities had to be taken on a case-by-case basis.
Gotcha.
So in the acute side, we were really upgrading from the older version of MEDITECH to a new version of MEDITECH, but we really wanted to take that opportunity to clean up our medical records. And MEDITECH had a link to easily access the historical data out of the older ambulatory or EHR system. So we only migrated 2 years of clinical data. On the accounting side, we decided to start fresh, and we moved no AR data at all.
Okay.
On the ambulatory side, we were really an early adopter of the MEDITECH ambulatory system, so there was really no data migration path for us other than the old manual process. So anything that had an appointment or any patient that had an appointment, we created those appointments, and then we manually loaded the demographics and seeded their clinical data. But anything other than that got left in the old ancillary system.
Interesting. So is that, how did you approach the data that you didn't migrate? Because you have to retain it for a certain number of years and all of those things.
Yeah, so we've really, I guess, that was in 2015. And so we had 20 plus years of MEDITECH magic data sitting in that old MEDITECH system, AR that was still being worked out of.
You don't want to lose that.
No, we're still working down AR out of the acute and ambulatory systems. And then we had also, over time, acquired other ambulatory facilities and inherited their medical record charts as well. So fast forward to about a year ago, we had 8 applications with 26 databases comprising about 350,000 patient records. So we set out on a journey to identify a solution that we can migrate all this data into. And so we chose Harmony Healthcare as that vendor of choice and been in the process of migrating all that data out of those legacy systems into that centralized data source.
And was the motivation to really be able to stop paying those licenses, or was it security risk, or what kind of was the big motivation to kind of consolidate
it? Yeah, it was really all the above. One was really workflow based. We were trying to gain some efficiencies in workflow. Sure. We had clinicians accessing multiple systems to get access to that historical data. We were running a release of information in our HIM department out of multiple systems. IT still managing access in multiple systems so that they could get to it. And then you have the cybersecurity aspects of it. So we're still maintaining those historical systems which had vulnerabilities. Some of them were no longer serviceable by the vendor. The legacy hardware was sitting out there, and so we had the cost of maintaining that as well. So really kind of three.
Yeah, that's great. So Jim, let's loop you in here as well. Is this a common migration path that you see with other organizations, or what are some of the common approaches you see with your customers?
Yeah, it really is. Really, each customer is unique, as you might imagine. Often it's on the low end, how fast can we implement the production EHR? So there might be a minimal migration in that example. Okay. There might be cost drivers, time implementation, drivers, cost and maintenance on their legacy applications, example. To the other end of the spectrum, which might be a more more comprehensive migration. In either case, we still do a comprehensive archival strategy. So really the kind of key is for the providers to know that there's a safety net, meaning a lot of the providers are concerned about what data will be in their EHR go forward. A lot of them think maybe some of that data might be lost or excluded. The archive gives them the ability to understand that all the data is going to be in that legacy application for archival. So click away from the production EHR, typically single sign-on, to that production EHR to get to, for the archival, all the records, in that model.
Yeah. So, I mean, I think this decision is a really important one, because once you have an archive vendor, you probably don't change very much, right? Because there's a reason you have them as the archive vendor. So tell us what went into the selection process and what were the differentiators for you in the marketplace?
Yeah, sure. So, when we set out on this journey, we looked at the applications that we had. We looked at the data within each of those applications that needed to be retained for regulatory purposes or action-based purposes like our AR and things like that. We also looked at any application that we thought that might migrate into our EHR within the next 3 to 5 years and might get replaced or deprecated over time. So we looked at those and we brought together a team of 8 subject matter experts that had really data ownership within all those applications. And we created basically a set of questions that we set out to identify as needs of the organization. We sent those out to 8 vendors in the legacy archiving space, and then based off the feedback that we got from that, we narrowed it down to 3 vendors that we really felt met the needs of the organization, and we requested full-on demonstrations from those providers. The team also developed a decision matrix that we utilized to score each vendor. And so we were looking at things like, obviously, cost was important to us, being a small rural health organization. We wanted someone that we could continue to work AR down, because that was important to us. Being a city-county owned facility, we couldn't sell off the AR. We had to continue ownership of it and to continue to work it down. We wanted the ability to do single sign-on out of our EHR and access that information in a patient-centric context. We also, cybersecurity was a big thing to us, so we wanted something that had robust controls around it, that we could limit scope of access to least privilege. And we really wanted somebody that had showed a strong history with multiple applications extracting data and getting that information out and getting it usable into a new system. So, as far as differentiators are concerned, really one of the big differentiators was the ability to work AR. We found that a lot of vendors could extract the AR and give it out to you in reports and things like that, but they didn't have the ability to do that transaction-based posting that you continually to work down that AR out of that new archive solution. The other is we found that there's vendors that had really strong suits in certain applications, but really not robust cross-application ability to extract data. So those were probably 2 of the biggest differentiators that we found when looking for a vendor.
That's great. So Jim, anything you'd add about what really sets apart the Harmony Healthcare IT Health Data Archiver?
Sure. I think, as mentioned, really the platform's important. So feature sets are key. Not all archiving solutions are the same. So things like heavy, like you mentioned, AR wind down capabilities is one example on the financial side. Things like release of information workflows are really key for the HIM department. Again, how easy it is to filter and generate those requests, replies, really important. Things like purge capability. So once retention periods are met, can you remove the data if need be? A lot of customers don't like to do that, but it's good to have that capability if need be. As well as kind of equally important, if not more importantly, is the service capability. So a lot of vendors say they can do certain systems and decommission them, but really, having the breadth, depth, and capability and actually being able to do those is a different story. So unfortunately in the market, we've kind of sometimes come up being the archiver of archives. Again, we've been there, done that, done over 500 systems in the market. From anything from a homegrown doctor, who created his own solution to the largest, enterprise IDNs, that exist. So, really service as well as the product's really key in decision making.
So where's all this headed, Brian? I mean, with Migration Archive, you did your legacy clinical systems. Did you do other systems, and how do you think this is going to evolve in the future?
Yeah, so even though we're migrating EHR data, it wasn't just clinical. So there was business data, financial data that also got moved out of those systems. So we had a scanning and archiving solution on both the ambulatory and the acute system.
Okay.
That data is being extracted, and that comprised both clinical and non-clinical data in that scan data. So extracting that out, filtering it, and indexing it to the appropriate locations. We also had HR data. So at one time we had used MEDITECH as an HR platform. So we had payroll personnel data that has to be continuously kept for eternity. So I mean, we had a lot of a pretty robust data set that we were working with and looking to extract and move into a solution. So.
Yeah, and what's been the value of moving it all to that one spot?
So really, it kind of go back to those things that we were looking for, workflow efficiencies. So giving people a single location to access all that information from with a click out of the EHR, being able to access that, going straight to your patient, seeing all that information in a single location, whether it be ambulatory, acute, whether it be financial data, whatever. And then also the cybersecurity impact of it, being able to get rid of those ancillary systems and old legacy systems that we were maintaining access to. It makes me feel a little better at
Every
night.
CIO's dream. That's what I was going to say. Exactly, it's a challenge. Anything you'd add as far as the benefits your customers really love seeing?
Yeah, I think the underpinning really is security and confidence of knowing that the infrastructure and the technology is secure. I mean, there's nothing more, as a steward of that data that's important. So being high trust certified as an example is really a litmus test anymore. If folks are looking at vendors and they're not, again, cybersecurity is always a risk.
Sure.
But having that platform and security and framework is real important.
Yeah. Great. So Jim, where can people go to learn more about Harmony Healthcare IT?
Sure. Certainly can go to any one of our social media outlets. Harmony Healthcare IT is an example, is our website, as well as our social feeds.
Excellent. I appreciate you sharing your story and insights. I think everyone's got to solve this problem.
Yes.
There's too many legacy applications in healthcare, so we got to deal with it. So thanks so much, and thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, guys.
Thank you.